Extremely painful and sometimes involve a long recovery if surgery is required. Dr. Alan Saperstein of Boca Raton Regional Hospital joins us this afternoon to answer your questions. I just hear nightmare stories about people who have rotator cuff injuries, so we're anxious to learn a lot more about this today. Thank you for joining us. First of all, what is the rotator cuff?
Well, the rotator cuff is a group of 4 small muscles that surround the main joint of the shoulder. They provide stability to the joint so larger muscles can take the shoulder through a large range of motion. And where the muscles attach to bone, they become tendons, and it's the tendinous part of the rotator cuff that's most susceptible to injury.
Well, why is it such a problem for people when it becomes injured?
Well, when the rotator cuff becomes either inflamed or torn, pain results, and sometimes that pain can persist and can be very slow to recuperate.
What are the risk factors associated with an injury to a rotator cuff?
Well, most cases of rotator cuff tendinitis or tear occur from repetitive use of the arm in an overhead plane. So this is particularly problematic in athletes that use their arm overhead.
Like a tennis player?
Exactly, a baseball pitcher, a volleyball player. Now, sometimes there's some trauma. You could get a rotator cuff injury by a fall onto the outstretched arm. But it's important to note that most patients don't have any pre-existing injury or repetitive activity that causes it.
It just happens?
Exactly.
Really? Well, now, you did mention tendinitis and bursitis. What are they?
Well, tendinitis refers to inflammation in and around the rotator cuff tendons. Now, just above the rotator cuff tendons is a small sac of fluid called the bursa. When this area becomes inflamed, that's called bursitis. In most cases of tendinitis are associated with subacromial bursitis as well.
Okay, I started out by saying, I just hear these nightmare stories about the treatment. So if you have a rotator cuff injury, what are some of the treatment options available, and are they getting easier to treat than they have been in years past?
Sure. Well, initial treatment is conservative. We do activity modification, avoiding using the arm overhead. We do physical therapy to strengthen muscles around the shoulder. Sometimes we do cortisone injections into the shoulder, and that can be very helpful at alleviating symptoms.
Is it anything we can avoid?
Well, certainly in some patients, avoiding use of the arm overhead could potentially eliminate rotator cuff problems. In many cases, there really is no avoiding it. It's just a natural process that occurs.
But once you have the surgery to repair it, you're down and out for a little while, aren't you?
Well, that depends. The traditional surgery to repair a rotator cuff tear involved a large incision that split muscles, and it was rather painful, and there was significant post-operative recuperation and stiffness. More recently, though, many orthopedic surgeons, including myself, have started doing that surgery arthroscopically. It's a minimally invasive approach through several very small incisions that allow us to look inside the joint, and we can access the rotator cuff tissue, we can clean it, we can repair it down to bone, and we get excellent results with really much quicker return of range of motion and much less pain than we used to get.
Sounds much better. Thank you, Dr. Saperstein, for your time. Boca Raton Regional Hospital sponsors our expert and underwrites our Ask the Doctor segment. Back with more in just a moment.